Dr. James Liu, welcome to Neurosurgery Tales. I'm truly honored to have you here today to discuss not only your extraordinary journey in neurosurgery, but also deeper themes like resilience and the pursuit of technical excellence. From your early days in medical academic medicine to your bold transition to private practice and being at the same time a global innovator and educator, it's a really one type of story full of depth and mastery. Let's talk more about this.
Great. Thank you. Thank you for inviting me on your show. It's a real pleasure and honor to be here. And I look forward to talking to you about my journey in becoming a neurosurgeon.
When you look back at your early steps into medicine and surgery, what pulled you specifically to neurosurgery? Was there a moment that felt like a calling for you?
Yeah, great question. When I entered medical school, I had no idea that I would be a neurosurgeon. In fact, I grew up a son of two doctors. My dad was an OBGYN. And I think, he repeatedly told me, yeah, you're going to be an OBGYN and join my practice after you graduate. So, and I think early in medical school, took a liking to the neurosciences. I really enjoyed the neuroanatomy, the neuropathology, and then the clinical diagnosis of neurology conditions. And, one day I attended a seminar that was in the medical school auditorium, and it was a guest speaker. It was actually William Caldwell, who was the chair of neurosurgery at the time at my medical school in New York, and he gave a lecture on skull-based surgery. And so from there, I contacted him and asked him to shadow a few cases, and eventually I did a rotation in the field, and that's sort of what drew me. It was just sort of the fascination of the anatomy of the brain, the complexity of the conditions to treat, the technical challenges to get to difficult areas in high risk situations. And all of that just sort of drew me to the field. I mean, I really do believe neurosurgery is a calling. If you look at the people in our field, it tends to be people who self select themselves.
Mm-hmm.
It's when you wake up in the morning and there's nothing you can imagine doing other than neurosurgery. And there's a deep burning passion for it, passion to take care of your patients, passion to try to advance the field. And I think Steve Jobs puts it best. It's when you finally find your passion, you don't really have to work another day in your life. And
Mm-hmm.
I honestly do feel that in my career. I feel that each day when I go to work, it's something to look forward to. The next
Mm-hmm.
case, the next challenge in the OR. Um, it's an amazing profession, and I'm humbled and I'm honored to be a part of it.
We now live in a world that is driven by metrics and competition. And what did it mean for you to follow your heart? Were there moments when you doubt yourself or um, keep you like away from the conventional path to become a neurosurgeon?
Yeah, I think one of the things that I experienced early on, I think every neurosurgeon will probably experience in their career, is when you deal with your first complication, post-op complication, and it's the major one. I remember my first year in practice. You finish fellowship and you think you're on top of the world. You get quickly humbled. I dealt with a difficult skull-based tumor, and patient had an unfortunate vascular complication, and very quickly self-doubt creeps in, and
Mm-hmm.
you quickly can, you crawl into this shell and you think, gosh, how am I in the right field? How can I do this? And it's a terrible feeling, and it's going to happen many times in your career. It doesn't happen just once, but you have to continue to learn from it and to improve yourself and to change. You have to be able to have self-reflection and be able to be honest with yourself and evolve and maybe change your philosophy, change your strategy, change your technique, and not be proud to not ask others for help. Even after 18 years in practice, I still contact close friends and colleagues to ask for their opinions on various cases. I remember that first complication. I was my heart sank, and you feel like I don't know if I can go back in the OR and do this. And I remember my first boss, my chairman. His name was Hunt Bajer, and he sent me this really encouraging email. He said, you know, commiserate now, but you know, get back on the saddle with guns blazing tomorrow. And I thought that was incredible. Like it really uplifted me in a
Mhm.
lot of ways, and to have someone who was supportive and encouraging, sometimes it's hard to find people like that in our field, but that really helped, give me a bigger picture on things, and it's something I say to younger neurosurgeons and trainees now too, so I can pay it forward in that respect.
How do you personally define resilience, and how has your understanding of it changed over time?
I would say resilience is dealing with adversity and being able to overcome adversity. Adversity is unavoidable. You're going to have situations where life knocks you down, whether it's personal or professional, and you have to be able to see through you go through a period of darkness in the valley, and you have to be able to come out at the end of the tunnel. It's about being able to pick yourself up and pushing through the obstacles, and coming out on the other side. So I think it's really important to and I think it's an important quality as a neurosurgeon to have.
And you also mentioned that those cases in neurosurgery that teaches you humility in a very profound ways. Have there been moments when your voice was challenged by the weight of uncertainty or failures?
Yeah, I would say um, neurosurgery definitely humbles you in a lot of ways. Just when you think you know enough or you know something, there's a lot that you don't know, and oftentimes you can be dealt with a clinical situation where you don't have the answer for the patient,
Hmm.
and sometimes you have to be able to say that, say I don't know why this is happening, or I don't have the right answer for you. Um, and I think it goes back to my discussion about complications. Complications, they're sometimes inevitable, even when we do our best. And the important thing is to acknowledge it and to help the patients and families carry through and get through the period of the complication. So, and to be honest about discussing them.
You've chosen to perform procedures most surgeons avoid. What makes you say yes to the case others say no?
Yeah, I would say I often say yes because I see beyond the risk to the possibility. I see patients who come to my clinic with a tumor that they've been told that is inoperable and it can't be done. But I always look for the solutions. I looked for ways that we can push the boundaries, and I always try to make a commitment to do everything I possibly can in my abilities. Um, one example of these types of tumors is paragangliomas, and I treat a large number of these complex tumors. Some of them are very adherent to cranial nerves and large vessels. Unfortunately, it's a type of pathology that is becoming less and less operated on at many centers. So, unfortunately, our team, we've continued to develop, a technique and also produce good outcomes on these tumors. And so, I when I hear the word inoperable, I'm always challenged, and I always look for the possibilities of being able to overcome it and finding a solution. But at the same time, it's important to know the limits and know your limitations. Um, there is a lecture that I frequently give that's called Walking the Line Between Radicality and Functionality. So it's important that we do enough to make meaningful intervention for, say, like a
Hmm.
tumor, to make meaningful oncologic resection, but at the same time, you don't want to do it at the cost of the patient's function. So it's about knowing your limits and knowing when to stop and knowing when you have to leave a small residual behind and then treat it with other means. I would say nothing is completely inoperable. There's always a solution.
And you've been unafraid to use less conventional approaches when they serve the patient better. How do you balance innovation with safety in such a high stakes procedures?
Yeah, when it comes to innovation, I think it's important to be able to think outside the box. And there are situations where the textbooks don't really teach you, and that comes with experience. I think there's a concept that I call situational neurosurgery. It's kind of like in sports when people refer to situational football, so to speak. You have to be able to read the room. You have to be able to read your opponent. In the operating room, it's the pathology that you're dealing with. So you have to be able to interrogate the situation and read the room. Surgery is there's probably a myriad of 10,000 decisions that you're making second by second in surgery, and it's not, although there's a conceptual strategic, step by step, you're constantly making decisions, based on what the opponent or the defense is giving you. And so you have to be able to, make decisions on the fly. And sometimes you have to change your strategy. And even sometimes you run into a situation of duress. I recall many moments where you're working on, say, an aneurysm and it unexpectedly ruptures. And the amount of blood that you're seeing sets off a sympathetic reaction in the surgeon yourself.
Yeah.
And you have to be able to deal with it, and you have to be able to maintain your maintain your cool, and you have to command the room, where you become a conductor, and you have to orchestrate and dictate the situation. You have to tell the nurse, give me this instrument, give me that, and you don't panic. And then you have a protocol in your head on, how do you handle these situations. And it's much like it's what I call the Sully phenomenon. Sully, who landed the plane on the Hudson. He
Hmm.
had to think outside the box. Obviously, he was a trained pilot and he followed protocols, but when protocols don't work, you have to be creative and innovative and then think outside the box. You have to be able to land the plane safely so
Hmm.
that your patient gets off the table in a safe manner. I recall a situation where I was treating a carotid body, a paraganglioma, and the tumor was adherent to the artery. In fact, it was eroding through the artery,
Hmm.
and I didn't anticipate that, and it was like bleeding like a fire hose, and I had my assistant put his finger on the bleeding spot just to control the bleeding so the blood doesn't
Yeah.
hit your face. And just by simply doing that, you can start to breathe. As the surgeon, you can say, okay, we're not, the blood pressure is not falling to zero. The patient has a heartbeat, we can
Yeah.
breathe. And then we can start to think, okay, what is the next step and how do we fix this situation? And then that's where you have to go back to your basics. And the basics are, well, you got to get proximal control. You got to get distal control. You trap the artery. Then you shut down the blood flow. And then you can inspect the hole. How can it
Hmm.
be fixed? And so, that is indeed, what we did. And, it's a spiritual, it's a spiritual experience. You often find yourself praying. You often find yourself hoping for the best outcome, but then you have to dig deep into your skill set and your knowledge and a little bit of luck. And
Yeah.
you can land that plane.
We often hear about surgical techniques, but how you train for judgment or for nuances that a textbooks can teach you?
Judgment is very hard to teach and train, but I think it comes through, as a trainee, it comes through mentorship. And in that position as a trainee, it's important to, essentially, I would say, pick the brain of your mentor,
Mhm.
understand what are his thought processes in going into a situation, a surgery, his decision making. What is his thought process in tackling a certain problem? And as a practicing neurosurgeon, it comes through experience. And so it's important to have as many reps as you can, like in sports, you want minutes, you want reps, and you need those experiences, because when it comes down to it, you learn from each experience, and not one experience is the same. Not one meningioma is the same. Not
Mhm.
one acoustic neuroma you deal with is the same. Every tumor or lesion has its own unique characteristics. And I believe that the more cases and situations and different patterns of what the radiology looks like, different patterns of how you did the surgery, what happens is, after years of experience, you build in an internal AI in your brain, right? We always talk about AI these days, but we have our own AI. It's our brain. And the more experiences you have, you build a database of these things, and you have to be able to remember these experiences. And oftentimes it's you say, oh yes, I've seen this before, or I've been in this situation before, or I remember that last case where I dealt with the same thing, and this is what we did that worked. And then you remember, well, this is what we did and it didn't work so well. That's how you build your judgment, is through experience.
You moved from academic neurosurgery to private practice, which is fascinating, especially because you maintain an academic mindset. What guided that transition? How was that possible for you?
Well, I think I was in a unique point in my career. I was already 16 years in practice. I was a full professor, and I was at a unique juncture where I had the opportunity to, be in a private practice setting where you had the autonomy of more autonomy on how you ran your practice, your style of practice, and the freedom and liberty, to do that, and also the opportunity to, be a business owner. At the end of the day, at the end of your career, if you have the opportunity to, be an owner of your practice, that's a very unique opportunity,
Hmm.
instead of having your practice being owned by a larger corporation, health system, or university. And being academic, it's I've always been academic at heart. I feel that being academic is in my DNA. Ever since I was a medical student, I just had the desire to want to write a paper, publish, contribute to the literature, contribute, and to be innovative, to help advance our field. And I love educating. I love lecturing. I love being on the podium on a
Hmm.
national and international stage, being able to disseminate information so that others can learn and improve in their ways of doing neurosurgery.
Do you think, from your experience, can private practice become a new kind of academic frontier?
Absolutely. I think it can be a space for clinical innovation, patient-centered research and teaching. Being academic, I think we there are several examples out there in our community where we've seen the hybrid of private practice and academia, and there's a lot of advantages of having this hybrid model. It doesn't probably Being private practice does not have to be the antithesis of academia. It can be its evolution.
Hmm. You also found the Art of Brain Surgery series and is a masterclass in both skill and vision. What inspired you to create it?
Yeah, that's a great question. I was given the opportunity to start a webcast, and
Hmm.
what I wanted to be able to teach was sort of the pearls and nuances that you don't get in your regular textbooks. the tips and tricks on how to do certain surgeries, how to remove difficult, challenging tumors in deep, challenging locations. And, I'm a huge fan of surgical video. I think surgical video has really changed the game in terms of education. When I was growing up in neurosurgery, there wasn't surgical video, there wasn't YouTube. It was just textbooks. It was
Hmm.
Schmidt and Sweet with black and white pictures, and you were trying to figure out what these pictures meant, and it was difficult to interpret the anatomy unless you experienced it in the OR. So as a resident, I was very diligent on downloading every video of my mentor, Dr. Caldwell, who's a
Hmm.
legendary neurosurgeon. And I would edit these videos for a weekly conference. And in the process of editing those videos, I was learning how to do the surgery.
Hmm.
And I try to teach that to my residents. When you edit the video, you start to dissect and figure out what are the key components and what are the steps that advance
Hmm.
you from step A to step B, all the way to step Z, where you complete the surgery, and you learn the anatomy that way. And I still do it today. Surgical video I use as a self-reflection tool. I can always go back and see, what did I do that was really good, that was really innovative, that really helped get me to completion, and what did I do that where I struggled, and what can I have done better. And it's like, I use a lot of sports references, because I think sports and neurosurgery are very closely related in a lot of ways. I look at Tom Brady's work ethic, and Tom Brady is a legendary quarterback who, they call the GOAT. Um, and he's a GOAT for a lot of reasons, and one reason is he does a lot of self-reflection. Every Monday morning, he's the first one in the office, and he's looking at game tape. He's looking at, what did he do wrong, or what could he have done better. And I think, as neurosurgeons, we have to do the same. We look back at the tape and say, man, where did I struggle? I didn't quite understand that part of the anatomy. That was an obstacle I need to figure out, and I need to do better on. And so I think if we do that, we'll continue to evolve and advance and be the best that we can be.
Absolutely. And how do you cultivate curiosity and precision in an era that is increasingly shaped by the speed and automation? Specifically, now we have even AI.
Yeah, that's a great question. AI is talked about every day now, and I think AI is an excellent tool. It's
Hmm.
but it shouldn't replace us as humans having that curiosity, from a cerebral standpoint, and precision from a motor skill standpoint, right?
Mm.
I don't, in my opinion, I don't think AI would ever replace a neurosurgeon. I
Yeah.
think there's too much, there's more than just automation when it
Hmm.
comes to being a neurosurgeon. I think there are certain things that it can help us with, maybe getting easier radiologic or pathologic diagnosis. But, at the end of the day, at the core of being a neurosurgeon, it's about the curiosity in the science,
Hmm.
asking scientific questions of, what is this condition? Where does this
Hmm.
condition arise from? What are some better treatment options? And precision is about, holding yourself to the highest standards technically. And in neurosurgery, like I said, in examples I mentioned before, you're sometimes dealt with situations of duress, and you have to think quickly on your feet, sometimes think outside the box, and that's where the human element, I think, comes in. And unless the AI can reproduce that human element, I think we'll still be in business.
Okay. Uh, if you were to leave one guiding question for the next generation of neurosurgeons to ask themselves regularly, what would it be?
I would say, it's very important to remember your why, right? Remember your why means, why do you do what you do? You know, it's easy to, have days of discouragement, and, there can be dark days in your career. And
Hmm.
when you go back to remembering your purpose, your passion, your calling, uh, it can help redirect you and recenter you. And, you can continue back on the path, on your journey, and, get to the end of the tunnel. And the other question I would also leave with them is, it's important to always ask yourself, what can I do better today than I did yesterday? Because it's important not to be complacent. You should never say I've arrived, or you should never say, I, I've learned everything I can learn. And that's when you get humbled, right? If you're too arrogant in that way, you're gonna miss the mark, and you're gonna miss important things, that can help you be better. Because there's always room for improvement. There's always ways to learn new ways. Technology is always evolving in our field very fast. You
Hmm.
have to you have to be able to adapt and learn new things. Taka Fukushima, the late Taka Fukushima, was a very influential person in my career. I would consider him a mentor. I attended his courses as a second year resident. Going into attending hood and being a professor, I was a guest at many of his courses. And every course he would say, and this is the master, right? He's one of the legendary masters. He would always say, I'm still learning. And I just thought that was an incredible statement, coming from somebody with 40 plus years of experience, who's probably seen it all, done it all. And he still says, I'm still learning. So I think I hold that close to my heart, and I try to say that as well.
Dr. Liu, thank you so much. It was an amazing interview. It was a pleasure to talk to you and to share your knowledge with a broader audience. Thank you.
Great. Thank you very much. It was a pleasure and honor to be here.